Ladies and gentlemen, our institution rose from its humble beginnings, from an army tent to what is known today as the Cagayan Valley Medical Center. In 1945, our facility sprung from an army tent that served wounded military personnel and ill civilians. It was then called the Philippine Civilian Auxiliary Unit after the declaration of the Philippine independence. On June 20, 1945, it was renamed Tuguegarao Hospital with 25 beds capacity. In November of the same year, under the administration of Governor Baldomero Perez and by virtue of provincial resolution, it became the Cagayan Provincial Hospital. Soon, it became dilapidated, hence it was transferred to the Division School building, where the construction of a two-story building that held 200 beds began. Today, the building serves as the Provincial Health Office. In 1963, the Cagayan Provincial Hospital was designated as the Regional Training and Teaching Hospital by virtue of Administrative Order 79, Series of 1963. On April 22, 1980, it was reclassified as the Tertiary Regional Hospital by virtue of Ministry Order No. 83, Series of 1980. On May 1, 1985, it became the Integrated Cagayan Regional Hospital, wherein the Regional Health Laboratory and the Regional Mental Hospital were integrated to it. On September 19, 1989, it became Cagayan Valley Regional Hospital per Republic Act 6783. It was finally converted to the Cagayan Valley Medical Center, or CVMC, on May 20, 1998 per Republic Act 8599 with an authorized implementing 500 beds capacity. CVMC serves the whole of Region 2 and its neighboring provinces. On November 13, 2020, the bed capacity of CVMC increased from 500 to 1,000 beds by virtue of Republic Act No. 11498.
The Cagayan Valley Medical Center, or CVMC, is the biggest and the only Level 3 hospital in the Cagayan Valley region. It is at the heart of the regional center in Tuguegarao City, province of Cagayan. It is located in the northeastern part of Luzon, which is about 480 kilometers away from Manila. The city is accessible by a 10-hour bus ride from Manila via the North Luzon Expressway and the Maharlika Highway. There is one daily airline flight to and from Manila and twice a week airline flight to and from Basco Batanes. The Cagayan Valley region has a total land area of 29,836 square kilometers with a population of 3,451,410 as of 2015. The population density for every square kilometer is 116,000. The region is composed of the 5 provinces of Batanes, Cagayan, Isabela, Quirino, and Nueva Vizcaya. CVMC also caters to the neighboring provinces of the Cordillera Administrative Region. CVMC is a DOH-retained hospital, and it is operating within the budget subsidized by the national government as embodied in the General Appropriations Act and from the income generated from its operations. This table shows the appropriations for CVMC as provided in the General Appropriations Act for the calendar years 2015 to 2020. From 2015 to 2020, the budget for personnel services has been increasing due primarily on the implementation of the salary standardization law and the filling up of authorized positions necessary in the hospital operations. Our appropriations for MOOE is not constant, as can be seen in this table. This is despite our earnest efforts in proposing for higher MOOE. Our MOOE is augmented by a reasonable increase in our income, thereby sustaining the operations of the hospital. Capital outlays released through the Health Facilities Enhancement Program, or HFEP, as provided under the General Appropriations Act. HFEP appropriations are used for the purchase of medical equipment and construction, upgrading, and expansion of government healthcare facilities. As shown in this table, CVMC's absorption capacity is very satisfactory, having 100% utilization rate for MOOE and almost, if not 100% utilization rate for personnel services and capital outlay. This table shows the hospital income obligated and ending balance from 2015 to 2020. It also shows breakdown of income collected from out-of-pocket payments for hospital fees and charges, field health reimbursements, and others. Out-of-pocket collections consists of payment borne by patients and payments from medical assistance to indigent patients. This table shows the statement of financial condition and results of operations from calendar year 2015 through calendar year 2020. Pursuant to Republic Act 8599, Cagayan Valley Medical Center is authorized with 500 beds, and it currently operates with LTO number 02-0263-21-HR-3, valid until December 31, 2021. By virtue of Republic Act 11498, ratified on November 13, 2020, CVMC has been upgraded to 1,000 bed capacity. Implementation of this law shall start on the last quarter of 2021. Health centers and hospitals, both public and private, in the region refer their patients to CVMC for emergencies, complicated and tertiary level medical, surgical, obstetric and gynecological care and/or diagnostic workup, and for higher level of care. However, even primary and secondary cases are referred to CVMC for varied reasons. They come from Tuguegarao City, Cagayan Province, Isabela, Kalinga, Apayao, and Batanes. CVMC is the lead hospital in the Tuguegarao Cagayan Health Zone. CVMC also provides trainings for personnel from other facilities. Hospital staff act as consultants, resource speakers, facilitators, and trainers for conferences and trainings in other institutions. As has been previously mentioned, CVMC is authorized with 500 beds and it currently implements 250 beds for all the wards, 50 beds for the pay wards, and 200 beds for the behavioral medicine wards. However, since the outbreak of the COVID-19 pandemic, CVMC has been designated as the COVID-19 hospital in Cagayan, and the pay wards have been converted into COVID wards. In 2019, we have recorded a bed occupancy rate of 159.44%, 98.82% in 2020, and 102.94% in the first half of 2021. As of July 31, 2021, we have a total of 2,435 employees, 1,489 of which hold plantilla positions, while 722 are service contract workers and 224 are human resources for health. Apart from patient care, CVMC is also a center for teaching, training, and research. It has highly departmentalized clinical departments and is capable of providing tertiary level of care as well as administrative and support services like clinical services, ancillary services, and other support services. Now here is the status of our operations. In the interest of time, we humbly request our panelists to refer to our email sent in March of this year for our proposed development options. However, here's to give you the gist. For human resource management, the CVMC shall continue to honor the positions, security of tenure, and other rights of its human resources. The hospital shall evaluate the existing health human resource complement, reclassify and/or upgrade positions, promote professional development, and hire additional staff to comply and conform to the TOH standards and other accrediting institutions and professional groups. The CVMC shall increase its health personnel based on recommended staffing pattern for a 1,000 bed capacity hospital following Republic Act 11498. Manpower complement shall be addressed from time to time depending on staffing needs analysis. Now for beds, level, and services. We continuously work and strategize to improve our services and be responsive to the needs of our stakeholders. We envision to become the reputable regional apex multi-specialty center in Northeast Luzon. Our mission is to provide people-centered care, advanced training, and ethical research to the community we serve as our contribution to nation building. With our vision and mission, we will be guided by our core values of integrity, compassion, accountability, resiliency, and excellence. With this vision, we position CVMC by 2021 to be a 1,000-bed tertiary hospital with regional specialty center of heart and lung, trauma, kidney, eye, behavioral medicine, and geriatrics. And now for infrastructure and equipment. The CVMC shall implement construction, repair, and renovation of existing physical structures to conform to all existing laws and licensing standards and current international standards for hospital buildings in line with Hospital Safe from Disaster Program, among others. The support from the TOH Central Office shall enable us to plan and undertake various care infrastructure projects, renovations, and repair of the various clinical wards, including the rehabilitation and renovation of existing buildings. Additional infrastructure and facilities will be responsive to the needs for healthcare and planned expansion of services. And now for the final part, we have here the financial analysis of the proposed development options. We can see here the projected cost of proposed development options, the projected income collection, and the projected investment requirement of proposed development options for capital outlay. Here we can see that there is a budgetary surplus on the projected investment requirements of proposed development options for capital outlay. Budgetary surplus or deficits shall be requested from the Hospital Facility Enhancement Program for funding. And now these tables will show how we spread out our investments in the next few years. This is our hospital development plan as we continue to be bigger, better, and more. In behalf of Cagayan Valley Medical Center, magbalo!